My name is Josiah Northern. I'm a firefighter paramedic with the Castle Rock Fire Department. This is my partner Adam Gallegos. He will be simulating the patient for this scenario. Today we're going to be going over the medical patient assessment scenario. First and foremost, you can verbalize wearing body substance isolation, or you can come in wearing gloves and eye protection. The scene size up portion of National Registry requires 5 points. The first point is scene safety and situation control. The second point will be the mechanism of injury or the nature of illness. For this scenario, it'll be nature of illness for a medical patient. You need to determine the number of patients. You need to consider additional help if you have more than one patient. And you also need to consider C-spine stabilization precautions. Under the initial assessment portion of National Registry for a medical patient assessment, you'll be judged on 3 things that will give you 3 points. 1 is the general impression of the patient, sick or not sick. 2 is going to be their level of responsiveness or their level of consciousness. 3 will be to determine their chief complaint and to address any life threats. You'll move on now to the airway, breathing, and circulation portion of this scenario. Under airway and breathing, there are 3 points you can obtain under this area. 1 is to assess the airway to make sure it's patent. 2 would be to assess ventilations, the patient's breathing. And 3 is to make a decision on whether or not the patient needs to be placed on oxygen therapy. Under the circulatory portion of National Registry, you'll get points for 3 specific areas assessing circulation. 1 is bleeding control. 2, skin condition, pink, warm and dry, cool, clammy. 3 would be to assess pulses in your patient. Once you've determined airway, breathing, and circulation and have hit all 3 points, you'll move into now to make a transport decision and take your patient to the hospital. This can be verbalized. The next portion of the medical patient assessment is the focused history, physical examination, and rapid assessment. You'll be given 8 points for identifying the OPQRST acronym. O meaning onset, P meaning provocation, Q meaning quality, R meaning radiating, S meaning severity, T meaning time. The last 2 points you'll get are for asking any clarifying questions based off your OPQRST questioning. The second part is a sample history, and that stands for sample is signs and symptoms, A is for allergies, M is for medications, P is for past medical history, L is last oral intake, and E are events leading up to the illness. This time you'll be asked to delve more into the systems involved once you've gathered your OPQRST and sample histories. And what that means is the neurological system, the respiratory system, the cardiovascular system, musculoskeletal system. Any of the systems that come into play in your OPQRST and sample history, you'll be giving 5 points for assessing that. The next portion is vital signs. You'll be given 1 point for a pulse, another point for a blood pressure, 2 points for assessing respiratory rate and quality, and a final 5th point for assessing AVPU, which is your patient alert to verbal, painful stimuli or unresponsive. After you've gathered vital signs, you'll move into the diagnostic portion of the test. For example, if your patient is having chest pain or shortness of breath, you'll be asked to place the patient on the EKG monitor. And at this time, you'll verbalize to your evaluator about your field impression. Once you get your field impression, you'll be asked to give a treatment plan and then reevaluate your transport decision. During the ongoing assessment, you'll receive 4 points for the following criteria. 1 is to repeat the initial assessment. 2, to repeat vital signs. 3, to evaluate any responses to the treatments. And 4, to repeat the focused history and physical exam. And this concludes the medical patient assessment scenario.